Good morning, everyone. My name is Sue Wykin. I am the Marketing and Event Coordinator here with Kendal at Home, and I'd like to welcome you to today's edition of Care Coordination Corner. Our host today is Cheryl Deathrage. She is a care coordinator from the Northern Ohio area, and I'm going to let her introduce our other two people. Before we get to that, just a little housekeeping rules. If you want to see, we will be sharing some slides, but if you would like the tiles to be bigger on your computer, you can go up to the little view in the upper right-hand corner and click on speaker view, and you'll see the people who are speaking. We are also recording this so that we can put it on our YouTube page and people can view it later. So Cheryl, if you'd like to take it away, that'd be great.
Thank you so much, Sue, and thank you for the introduction. Hi, everyone. I'm so glad that you could make it and join us today to learn more about sleep apnea. I have two very special guests here with me today. I have Paul Smaldone, who's from Inspire, and I have Eric Carpenter, who is actually a member of Kendal at Home. So I would love for perhaps Eric to start, and if you'd like to say a few tidbits about yourself, introduce yourself to the participants today.
Sure. Good morning. I'm Eric Carpenter. I live in Oberlin. I've been a Kendal at Home member since 2013. My wife and I are both retired. We work for Oberlin College, and we both worked in the college library. So I got to buy books for a living. It was great fun. And I will be talking about my experience with sleep apnea. How I used the Cpap machine and then discovered the Inspire implant. So that's what I'm going to present today.
Thank you, Eric. We're so glad you're here and you could take the time to talk with us today. Paul, next, if you wouldn't mind sharing a little bit about yourself, and then I'm really looking forward to jumping in and seeing your presentation today.
Sure, absolutely. Thank you, Cheryl. Excuse me. Hello, everybody. My name is Paul Smaldone. I reside in Cleveland, Ohio. I work for Inspire Medical Systems, and I've been with Inspire now for actually just a few months, but I'm on the business development side with Inspire. My career has been within the pharmaceutical industry. I had a little tidbit in the wine industry, and then I came back into healthcare, and I've been working in the medical device space for a while. And when I came into the medical device space, a friend of mine who had just joined Inspire about 4 years ago turned me on to the company and the therapy. It just seemed so innovative, life-changing to me, as I have sleep apnea, runs in my family with my parents. So I'm very proud to be here with Inspire. It's been years since I've been waiting for an opportunity to join the team. And so, I hope that you learn a few things about sleep apnea and about the Inspire therapy and the different options that are available. But if anything, I really hope you take away some of the passion that I have for this therapy. Of all of the things in my 20+ career of sales and business development, this is really, for me, the most satisfying, because I see firsthand lives changed, and that's always a great thing to be able to do in your profession. So with that being said,
Paul.
yeah, absolutely. So with that being said, would you like me to share the screen and jump right in?
That'd be wonderful. Sounds perfect.
Right. Wonderful. Okay. So we're going to talk a little bit about just sort of the basics of sleep apnea. We'll lay out some definitions and some key terms that you may already know or that you may learn as if you have sleep apnea that you sort of work through your therapy. You'll hear these terms used often. We'll talk a little bit about first-line therapy and different options from there, different tests that we use to gauge your level of sleep apnea. And then we'll spend some time talking about Inspire, of course. So what is sleep apnea? Very basically, sleep apnea causes you to stop breathing for anywhere from a few seconds to even as long as a minute. And you may not realize that if you have sleep apnea that you even have it. And a few seconds might be hard to detect, but I challenge you just to imagine what it's like to hold your breath for an entire minute, and then imagine while you're sleeping that is happening maybe 30 times in an hour. And if you realize the importance of sleep to our health and what that does in terms of restoring us on a nightly basis, if you're disrupting that sleep, you can imagine the amount of complications that can be caused with that amount of stoppage in your sleep. So sleep apnea is kind of a new concept. It's been around for such a long time, but everybody just assumed that it was snoring, and it's just way more than snoring. Snoring, of course, is one of the main symptoms and signs, but it's way more than that. And you'll see the comorbidities and the different areas of your health that it touches. So how do you know that you have sleep apnea? As I mentioned, that snoring, many people associate sleep apnea with snoring. Well, that is certainly part of it, and it is the most common sign. But some of the others are silent pauses in breathing, choking or gasping sounds. Your sleep partner may detect that. You may not even know that you're doing it, but your sleep partner may say, "Hey, you woke up a couple times last night choking," and you may not realize that you're doing it. Daytime sleepiness or fatigue, insomnia, morning headaches, nocturia, difficulty concentrating, memory loss, decreased sexual desire, and irritability are all symptoms and signs of sleep apnea. And as you can see on the right here, just different comorbidities or areas of your health that it touches. Anxiety, depression these days is such a hot topic. High blood pressure is so prominent. Diabetes, impotence, obesity, low blood oxygen levels, stroke, all of these things are very serious health consequences. So to define sleep apnea, well, there's two different terms that I'd like you to learn, and one is apnea. Apnea is a complete closure of the airway for at least 10 seconds. A hypopnea is a partial closure of the airway for 10 seconds. So when you go for a sleep test, whether you're doing it in a sleep lab or whether you're doing a home sleep study, this is the measure that they're going to use to define whether you have sleep apnea. And they're going to measure it in this form, an apnea hypopnea index. And that basically will calculate the number of those events that occur within an hour. So if you look down below, if you fall underneath 5 apnea or hypopnea events within an hour, you're normal. You do not have sleep apnea. If you fall between 5 and 15, you have mild sleep apnea. 15 to 30, you have moderate, and anything greater than 30 is severe sleep apnea. I mentioned a few different types of tests. So the way that we establish that AHI number is 2 ways. One is an in-lab polysomnogram, otherwise known as a PSG. That's where you'll go to a sleep lab late at night, and they'll hook you up with all different types of testing devices, and then they ask you to sleep as if everything's normal. We get a lot of information from that. I know that usually is number one, inconvenient, and number two, not the best way to emulate normal sleep. But we do gather a lot of information from that. And as I'm sure Eric will let you know, once we talk about the Inspire care pathway, we utilize this PSG to titrate if we're not at the ideal therapeutic level. And then the other option is a home sleep test. And there are a lot of new advancements in very good ways with home sleep tests. There's some very good tests out there. So if an in-lab sleep study is not appropriate or reasonable at that time, doctors are likely to prescribe a home sleep test. So types of sleep apnea. The most common, the one that we're going to be speaking of today and discussing, is obstructive sleep apnea, otherwise known as OSA. This occurs when the muscles of the throat relax and the tongue falls backwards, blocking your airway. And we have a nice little video that can show you exactly what that looks like. Less common is central sleep apnea. And that's basically when your brain doesn't send the proper signals to the muscles that control breathing. This type of sleep apnea Inspire does not treat. There are some other implanted devices that treats central sleep apnea. But basically, we try to rule out if you have greater than 25% central or mixed sleep apnea, then you would not qualify for the Inspire therapy. And then the complex sleep apnea is just a combination of both obstructive and central sleep apnea. So I mentioned the many comorbidities. High blood pressure, so prominent in the United States. Heart disease, along with that, stroke, diabetes, and depression. I'm sure that we all know people with one or more of these comorbidities. And these are so important to treat individually, but it's just exacerbated if a patient has sleep apnea. And if the sleep apnea goes untreated, we see the prevalence of, and the complications of each one of these comorbidities as the sleep apnea goes untreated. So I believe that the number now is that there's 22 million Americans with sleep apnea, and a lot of those, I believe more than half, go undiagnosed. Once diagnosed with sleep apnea, the first line therapy is Cpap. You might be familiar with Cpap, and I believe Eric will tell you about his experience in a little bit with Cpap. But I guess I'll wait to touch on the different treatment options, and just before I go there, to talk about a little bit further the consequences of untreated OSA. On a daily basis, fatigue and diminished productivity, snoring, which obviously disrupts your bed partner's life and may interrupt their sleep, causing not just one but two people to have diminished sleep. Heart and brain health we've talked about. And one thing we have not mentioned is the accident risk. So community safety. This is big within the trucker community. There are a lot of truckers that suffer from sleep apnea and have not been diagnosed, or if they have, are on Cpap and may not be tolerant and may not be getting the right treatment. That's very, very dangerous. If you can imagine the driver of an 18-wheeler on the highway who's likely to doze off and fall asleep, that is a very, very scary scenario. So treatment options. I talked about the gold standard being Cpap, which is continuous positive airway pressure. And we all know that from the mask and the hose and the machine next to the bed. That is the most common. It is truthfully the most effective if it's used, okay? And that's a big if. Because of the millions of people that are on Cpap, more than half, based on worldwide studies, are intolerant to it. Whether that be because maybe they're claustrophobic, or maybe they have a bad reaction to their skin, or maybe they, it just doesn't fit their lifestyle. Perhaps they travel for a living and they just can't bring that Cpap with them wherever they go. There's many, many reasons why patients may be intolerant. And, really until Inspire came along, there were few very effective alternative treatment options. A few of those, which have existed, are oral appliance therapies. So you would go to a dentist and they would make a dental device. These are effective more in your mild cases of sleep apnea. And you'll see on the next slide that there are some long-term complications with those. Positional therapy. So, there's different devices that can help you sleep on your side. If you sleep easier on your side and the sleep apnea is less, there's different positional therapy options. bariatric surgery. So there's a huge correlation between obesity and sleep apnea. And so bariatric surgery is an option. Then there's Inspire. And then lastly, there's traditional surgery, which is a UPPP. We'll talk about what that means, but those are basically all of your treatment options that exist at this point. So Cpap, usually 3 types of positive airway pressure. The most common is the Cpap, the continuous, which is where the air is continuously pushed into your airway. A BiPAP and an AutoPAP. The BiPAP is basically there's 2 different pressures that go in and then come out, and then the AutoPAP is like an auto-titrated positive airway pressure. Here's just a little bit about the dental appliances that are available and some of the benefits. As I mentioned, that it tends to work better with your milder OSA cases, and over the long term, it might cause jaw joint pain or even misalignment of the mandibular bone, which is your jaw. And so these aren't very ideal for long-term usage. And the surgical procedures that were available, if Cpap fails, as well as oral appliance therapy and as well as sleep positional therapy, the most common procedure is the UPPP, which is the uvulo-palato-pharyngoplasty. That's a mouthful. We just call it a UPPP to simplify it. And that's basically, as you can see with the diagram, where they just remove soft tissue. They remove your uvula, some of your soft palate, your tonsils. They basically go in like a carpenter and just remove a lot of soft tissue, which ideally would open up the airway and remove the obstruction that causes the sleep apnea. The clinical success of this is about 50%, which is not great. But until Inspire, there was no other next step. And it's also a very invasive surgery. So, people try to avoid any invasive surgery at all costs. And so this was really, for any physician, the last measure. And they, sleep clinics and ENTs and the many different specialties that try to treat sleep apnea, they try so hard with patients to get higher adherence to the Cpap, and sometimes it's just not possible, and that leads to frustrated medical professionals and frustrated respiratory therapists and frustrated patients. So now that Inspire is on the market, we are all very, very happy that there is an option now. Yes, it is a surgical procedure. However, it's proven to be safe and effective, where any complications or side effects are less than 1% of the patient implanted population. We have over 16,000 patients now since the inception 7 years ago. It's an outpatient procedure, so the surgery lasts anywhere from 1.5 to 3 hours, and about 98% of the current implanting physicians will send you home the same day. I do know a few that would like to keep you overnight. Here in Cleveland, Dr. Kaminsky at the Cleveland Clinic, he will send you home the same day. So it's an outpatient procedure. It's a very small implantable device. So if you can see, this is what the actual device looks like. So compared to my hand, and that just goes right under your skin at the chest level. It's MRI conditional, which may change in the near future. We have applied to the FDA for approval so that it's totally MRI compatible, but that should be about 6 months coming down the line. And it's controlled by a sleep remote. It looks just like this. And really, to the patient, this is the face of Inspire. This is what you deal with on a daily basis. You turn it on at night just by putting it to your chest like this and pressing a button. And you turn it off in the morning when you wake up by doing the same. And you're able to titrate the level of amplitude or the strength with this device. And we work very, very closely with each patient. Also through the sleep clinic, to make sure that we provide the right comfort settings. And I'll talk a little bit more about what that means in terms of the stimulation, making sure the stimulation is comfortable, as well as some of the pause and delay settings that are available. So we really do work very closely with the patient for months, if not years, to make sure that that the adherence is there. We've learned from Cpap that adherence is really the whole thing, and so we've tried to give each patient the best opportunity to adhere to our therapy. So Inspire eligibility requirements. Adults 18 years of older, this just changed from 22. So now more people have access to it, ages 18 and older. We are conducting clinical trials in the pediatric space as well. But at this point, adults 18 and older, diagnosed with moderate to severe OSA. So if you recall our definitions earlier, that would be an AHI between 15 and 65. And that would be determined from a recent sleep study, whether it be a home sleep study or an in-lab polysomnogram, so an in-lab PSG. It would be, I believe, within 2 years. So that number would be between 15 and 65. That derives from a recent sleep study. Cpap failure or inability to tolerate Cpap. This is somewhat subjective, okay? You would really need to work with your physician to determine, what that sort of quote unquote intolerance looks like. I know that some insurance companies require a patient to have at least tried it for maybe 30 days and some maybe 90 days. Some of them just need to see documentation from a physician that, perhaps for whatever reason, a patient just absolutely refused it. That would, in some cases, be considered failure or inability to tolerate. So, that one, there's a little bit of subjectivity to that you would need to work with your physician on. And then the last step in terms of the Inspire eligibility requirements is a sleep, basically it's called a drug-induced sleep endoscopy, otherwise known as a DISE. And it's an airway exam where we, using anesthesia, it's very quick, it takes about 10 minutes. Your ENT will do this and they'll put you to sleep. They will use an endoscope through your nasal airway and they'll look at the anatomy of your airway. And what they're looking for is a certain type of collapse of your airway to rule out what they call complete concentric collapse. So if you can imagine an airway that may open and close like this, that would be ideal. That's the ideal anatomy that the doctor is looking for Inspire to have its best outcomes. If you can imagine sort of like a sphincteral closure like this, that's considered complete concentric collapse, and that would eliminate you from eligibility for the Inspire therapy. The good news is that about 8 out of 10 patients that have a DISE performed do qualify for Inspire. It's very rare that we see that complete concentric collapse. So how it works, I showed you the actual implanted device, and I showed you the remote control. I believe I have a little video here that I'll play for you and kind of walk through exactly what's happening. So as you see the patient, before he falls asleep, we'll take the remote, put it up to the device, then press the button, and you'll hear a little audible signal that will tell you that the device is working. And what we can set is a pause delay. So what we'll do is when we activate the device, we'll ask you some questions. How long, for instance, how long does it take you to fall asleep? And you may say, it takes me 15 minutes to fall asleep. Some people say it may take me 45 minutes to fall asleep. Well, we don't want the device to turn on before you fall asleep. So we'll set a delay to make sure that once you press the remote control and activate it, you have enough time to lay down and fall asleep. And shortly thereafter, the therapy will begin. once it begins, this is what it looks like inside the body with just a little bit of difference. And I apologize that this video is somewhat old. When Eric had the procedure done a year and a half ago, we were using 3 incisions. One incision was done up here in the neck, where the stimulation cuff attached to the nerve. The other incision was done here in the chest, where the IPG or the battery was placed. And the third incision was down here in the ribs, where the sensing lead was placed that senses the breathing. Now, we are very fortunate at the beginning of this year, the FDA approved a 2-incision device where we have eliminated this one down here in the chest, and the sensing lead basically goes straight down underneath the IPG device. So there's a lot of benefits to this. You know, one, it's less incision that could possibly be subjected to an infection, surgical site infection. Obviously, a reduction of discomfort post-surgically. For the physician, it's less time in the OR. We've cut down the time by about 1/3 of this procedure. So there's a lot of advancements, and I can talk about some more that are upcoming. But this is one that doctors have and patients have really enjoyed and benefited from this year since the FDA approved the 2-incision procedure. So basically what happens is as this lead senses the breathing, we'll watch him turn it on again, and then you'll see it senses the breathing. It sends a signal up through the IPG to the nerve to push that tongue forward. You see, do you all see the tongue moving forward here and opening up that passageway? So what we found 7 years ago when this device was brought to the market and we started doing our clinical trials, we knew that the nerve that we're stimulating pushes the tongue forward, which opens up this base of tongue space. However, there's a coupling effect that we were surprised by that also opens up the soft palate. So it brings forward the soft palate, opening up this passageway back here. And I don't know if you can see my mouse, but so basically there's 2 different airways that open because of this therapy, which makes it more effective than anything else that's out there in the market. And this happens rhythmically and proactively as you're breathing throughout the night, removing any of those obstructions. So you can see that coupling effect that happens through the nasal and the base of tongue. And then in the morning, you turn the therapy off with the remote, and you go about your day, hopefully after having a wonderful night's rest. So I had mentioned the procedure being done through 2 small incisions. The recovery is typically very fast. There's no prescription medications that need to be taken. Typically, an over-the-counter pain medication is sufficient. We recommend, and doctors may have different methods, but returning to non-strenuous activities within just a few days. The battery life is about 11 years. You may or may not be familiar with a pacemaker. It's a very similar battery to a pacemaker. Pacemakers, they say, typically last about 7 years. The reason why ours last a little bit longer is because it's only used at night. We turn it off during the day. So it extends the life of that battery by a few years. So the average is about 10 years. And I had mentioned that it's MRI compatible at this point in the head, neck, and extremity. So we like to consider this a therapy and not refer to it as an implant or a surgery, because the surgery and the implant is really just a very small part of this. We work with the sleep clinics and really whoever the managing physician will be for your therapy so closely with the post-implant care. We call it our post-implant care pathway. What will happen after the procedure is about 30 days later, you'll come in to have the implant activated or turned on. So you're not actually using it within the first 30 days after the implant. The reason why we do that is to let the anatomy heal, to make sure that your incisions heal correctly, to make sure that the right tissue is scarred and holds things in place. We've found that 30 days and nothing earlier is sufficient for things to heal up, for us to then bring you into the office and activate the therapy. And what we'll do is we'll establish very initial settings. We'll establish your comfort settings, as I mentioned, your pause delays and everything. There's a function with the remote control where if you wake up in the middle of the night, you can press a button to pause. And if you have to use the restroom or get a drink or use the telephone, whatever it might be, we can set it for a 15-minute pause, a 30-minute pause, whatever your comfort level is. And it will automatically go back on after that 15 minutes is expired. And we show you how to use the remote, how to change the batteries, what the different, how to titrate. So we will meet with you 30 days to activate it and to educate you on the therapy. So clinically, and I don't want to bore you too much with the clinical trials, but just to show you how effective this is, these numbers come from a trial called the STAR trial. It was our pivotal study that gave us our indication. And just to show you the power of this therapy and what it can do, the baseline, these numbers represent that AHI, that apnea hypopnea index. Patients started at 29, so just to the severe stages. And after 3 years, reduced it to 6.2. We also have 5-year data that looks very similar to that, which equals a 79% reduction. So that's very, very significant clinically, which is what gave us the indication. Also significantly decreased bed partner reported snoring. So we like to consider this the 2-for-1. We're not just treating the patient with the implant, but also your bed partner is enjoying a better night's sleep as well. How do patients like it? This comes from an ongoing real-world registry called the ADHERE study, where we have over 3,400 patients registered. And our feedback is 94% positive, where patients are satisfied and would recommend their friends and family to use it. Adherence of 5.7 hours per night is way more significant than you would find from any clinical study done with Cpap. This page just showing, because of the clinical results, has led to, and I think what is the most common question that we get, and we're very proud to announce, is that most US insurance covers Inspire. Medicare and Medicaid covers it. The VAs are using it if you're military, but broad coverage across private insurance plans across the United States, which is very, very exciting. And that has been years in the making. And just really this year and last year, we've seen a significant amount of increase in approvals. As the interest in this increases, we're seeing that the plans are approving it as well. So as we are wrapping up here, is Inspire right for you? Well, you have to sort of answer these questions. Do you have moderate to severe obstructive sleep apnea? Are you unable to get consistent benefit from Cpap? We have a BMI capitation at 35. So is your BMI below 35? And then finally, once you go through the process, your ENT will give you an airway anatomy exam. And once you pass that, if you're 18 years of older, you would be qualified for Inspire therapy. I would encourage anyone who is interested in learning more. We have an Inspire Sleep app. If you have an iPhone or an Android, just go on there. There's an Inspire Sleep app. You download it. It's free, and it has a lot of videos and education. It also allows you to connect to a patient ambassador, which we're very fortunate to have our own patient ambassador here, on which I'll hand the mic over to in a few minutes. But we are very big on education here at Inspire, and we want to make sure that any questions are answered, no matter what stage of sleep apnea you're in. If you're undiagnosed and you're just curious, we can help you find the right doctors to begin that process. If you know you have sleep apnea and you are using Cpap and you hate it, we can get you right with the right people. So we give you all of the education that you need, and it sort of begins from our website. If you aren't able to download an app, you can certainly go to inspiresleep.com, or as I mentioned, download the app, and everything is right there at your fingertips. So here locally in Cleveland, I work with the Cleveland Clinic and the VA. There are other hospitals throughout Northeast Ohio that do the implants, but Dr. Alan Kaminsky is the implanting physician at the Cleveland Clinic, and the managing physician who you would see before and throughout your Inspire Care pathway would be Dr. Rundo's team in the sleep clinic at the Cleveland Clinic. And here's their information. If you need to jot it down, I'll leave this page up for you. With that being said, I thank you for the time you've given me. I hope that there's some questions. Eric, why don't we pass it along to you? You can talk about your experience with sleep apnea and how you came to learn about Inspire.
Okay. I was diagnosed with sleep apnea in 2002. I'd had it for several years, and my symptoms included, as you just saw, some typical symptoms: loud snoring, some snorting, tossing about during sleep, etc. My wife, was urging me to do something about this, and it took me a while to realize that I really needed to start dealing with it. And I finally approached my primary care physician and discussed the whole situation with him, and he explained some of what Paul has said, and said that I should see a pulmonary or sleep specialist to examine me further and see if there was a treatment that was right for me. So I did that, and the only long-term treatment then available was the use of the Cpap machine. And Paul has described what that involves: the face mask, the tubing, the portable machine that puts the column there down your throat, etc., while you're sleeping. And using this device was really difficult for me. I used it a long time, 2002 to, I had the implant done in 2020. I would have had it done a couple of years earlier if I'd known about, Inspire, but I didn't find out about it until then. Using the device, what happened with me is I could never find a mask that was right for me. I have a rather large head, and I had to get a wide mask to fit my face, etc. And the other thing was that the volume of air pressure needed to keep my throat open was quite a lot. I was titrated, and they wanted to use. I was struggling to use a machine that was producing so much air down my throat that it really bothered me. I found that very difficult. So I could not sleep more than 2 or 3 hours, consecutively, using the mask and the machine. And I usually woke up several times during the night groggy and irritated. When I finally got up in the morning, I was often tired, and I struggled to get through a day at work. I retired in 2007. My last 5 years of my employment was spent with the Cpap machine, which was better than the time before that. But I had trouble getting through a day. Sometimes I'd get to the point where I would just simply have to go home and take a nap and then come back. And, I had a librarian's office job and a wonderful library director who, listened to my problems and was very sympathetic to it. And he made allowances, in terms of my work life. So I would go home when I needed to during the day, have a nap for an hour, come back, and then often work into the evening to, get my work done. But this was not a good way to live. It took away from my home life. I was, my children were getting into their teens at that point, and I was needed at home, and I sometimes wasn't there. So this wasn't good either. So in 2019, my pulmonologist told me about Inspire and suggested that I pursue it. So I think I watched the video online, and I wish I'd have seen Paul's wonderful presentation here, because there was so much good detail, including some things that I wasn't aware of, new details that I didn't know. So I would encourage everybody who's listening who hasn't seen this video before to watch it again, especially if you suffer with sleep apnea. Watch it and give it some thought. My pulmonologist told me about Inspire, and he said it was being recommended for the patients who could qualify for it. So the Cleveland Clinic Sleep Center was open, and so I made an appointment to go and meet with Dr. Kaminsky, and he did those things that that Paul talks about. I had the evaluation of the implant, and he did that with me. He showed me the device, explained how it worked, etc. And then he described, how this is all at my first visit, how I would qualify for the surgery, just as Paul has laid out. And I needed to take the 2 tests. The first was an at-home sleep study to have the data, so they could have recent, very current data to analyze my condition. And then secondly, I would have to have the second exam, during which Dr. Kaminsky would put the scope down my throat to determine what kind of sleep apnea episodes I was experiencing. He also explained that if I qualified, what would happen was that Dr. Rundo and her staff would work with me to, first of all, just discover what the cost of this was and how my insurance would cover it. And the sleep center people, helped me get through that part. And then fortunately, I passed the qualifying test. My sleep apnea was a moderate to severe, so I was part of the 80%. I believe Dr. Kaminsky explained that to me, that 80% more or less of the people who take the qualifying test pass. So I passed, and so I qualified. And then in June of 2020, I had the implant surgery. I did have 3 incisions made, as Paul explained, and the procedure was, it was, as he explained, I now recall that it was longer than I was thinking when I was preparing my remarks for today. It probably was an hour and a half to 2 hours, but I had anesthesia. Their anesthesiologists are wonderful. So they, based on my medical data, they were able to give me the right kind of anesthetic that I needed. And, I was put to sleep, and then I woke up and the implant was there. And Dr. Kaminsky came in and spent some time with me, explaining how it went, what the next steps were, and just saying that he would see me soon for a follow-up visit and get me started on the, but he said everything went just fine. He said it was quite routine and there weren't any problems. So of course I was elated with that, and so was my wife. So the recovery process took about a month. During that time, I had to go back to wearing the Cpap mask again every night. And that was probably the worst part of recovery, because I knew that my time in hell was coming to an end. And so, I went back for the follow-up visits as he described them. And I won't, spend much time with that, because Dr. Rundo and her team, it's a team of 3. It's Dr. Rundo, and there's an assistant, and I'm forgetting her name, but it's also a woman. And then there's an Inspire representative that's there when, at each of these follow-up visits, that explains the remote. And he showed you the remote, which is good. I have mine here sitting next to me. I don't think you can see my face, but that's okay. Anyway, I'd be glad to answer questions, that anybody might have. So that's basically what I have to say. And I just think this is a wonderful, even possibly life-saving device for me, because I was not in a good place using that CPAP machine.
Thank you so much, Paul, and thank you, Eric, for sharing your story. Eric, I was excited when you agreed to come on and talk to, the rest of Kendal at Home and our staff and our members about your experience, because it sure seemed like it was a life changer for you, that it has made such a positive impact on your life. And I'm so glad that this type of option is available to people now. Yeah. Paul, this makes me, a question comes to my mind though. We talk a lot about, the Cleveland Clinic and where Eric had his implant done. We have our largest membership right now base is Ohio, but we also have a growing membership base in Massachusetts. And with Kendal at Home being portable, we do have members in other states. Is Inspire available outside of Ohio?
Oh, yes, absolutely. So I would say in every state, there probably is an implant center.
Okay.
If not, there would be something close by within a couple hours. But if you have questions about that, you can go to the website, inspiresleep.com. There's a find your doctor opportunity there. So wherever you are, you'll put in your zip code and it will give you a list of physicians that are close by based on the zip code that you put in.
Is there one in Columbus? I would guess that OSU Medical Center probably has a sleep center.
Yeah, so OSU, Dr. Chu is actually our company's #1 implanter. So that's the busiest Inspire center in the entire country, is down in Columbus.
Is there also one in Toledo maybe, or anywhere else, Cincinnati?
I believe there is one. Yes, there's definitely one in Cincinnati. There's one in Dayton. There is one in Toledo. I'm not sure what the account is in Toledo that's doing it. And here in Cleveland, the Cleveland Clinic does them. So does University Hospital, as well as Metro Health.
Okay.
Paul, one other question that came to my mind is, as a person who snores, and apparently I'm not quite 40 yet, but I do snore. I'm not ashamed of it. I think a lot of people do. If you start to see, as you age, that gets more severe, would you say that would be a trigger to say, hey, maybe something is going on, just predominantly progressive worsening snoring?
Yeah, as I mentioned earlier, that a lot of people associate sleep apnea with snoring.
Yes.
So it certainly would be something to start taking note of the other symptoms, right?
Okay.
So, if you snore on a nightly basis, and then go back and look at that list that it was earlier in the presentation.
Mm-hmm.
If you have daytime sleepiness, and there's a few of those symptoms also present with the snoring.
Mm-hmm.
That's what your physician would probably look at to say, okay, let's do a sleep test to find out if you truly have sleep apnea or if the snoring is caused by, by something else.
Something else. Yeah. I'm curious, you mentioned, I think it was 22 million Americans that is the guess that have sleep apnea, but only about half actually with treatment or seeking treatment, I believe you said. Now your device is available, 18 plus. Do you know, is it predominantly the older adults, maybe 60 and above, that have diagnosed sleep apnea and or have Inspire? I'm curious how that, along the age spectrum, how that.
Yeah, that's a great question, and I don't think I can
That's okay.
specifically give you the percentage of
Sure, no, I understand.
But I can tell you that most of our patients are older, more towards the 50, 60-year-old range than the 18. But just last week I was in an implant with a 25-year-old.
Wow.
So
Okay.
it's definitely something that younger people are learning about and realizing there's an option. Let's face it, younger people in general are more reluctant to to seek treatment for things like this, because they may not realize, first of all, a younger person may not have a bed partner to identify that they're snoring. You know, that's one of the reasons. So,
Eric, I'm sorry. I think you had something to add there.
Yes, I do. I wanted to ask Paul, it occurs to me that there seems to be a strong correlation between obesity, especially severe obesity, and sleep apnea. Isn't that true? And if so, aren't there a lot of people out there that have undiagnosed sleep apnea, especially when they're obese?
oh, absolutely. You know, of that 22 million, a lot of those are undiagnosed, and we kind of talked about the anatomy, right? And what they're looking for when they do the drug-induced sleep endoscopy. If you recall, I talked about that sphincteral closure of your airway. A lot of times that is caused by, someone that may have a thicker neck, caused, some caused by obesity, most caused by obesity. Some people just naturally have a thicker neck. But it's really the anatomy that causes that, right? Sort of causes your airway to collapse in that way. So if a patient falls above that BMI of 35, but has diagnosed sleep apnea, what Dr. Rundo would do, for example, is that she works with the bariatric team at the Cleveland Clinic, and she would recommend you to go see a bariatric physician to work, whether it's surgically or other alternative methods, to lose weight, to reduce your weight and get you down below that BMI of 35. And then that would likely allow, your anatomy to then present in a way that Inspire would be a correct therapy. So there is a huge correlation. As we know, obesity is a huge issue in the United States, and certainly a very high percentage of patients that are obese also have sleep apnea. So, yeah.
Wow. Thank you. I would imagine, I wouldn't be surprised if we have members of Kendal at Home coming on and watching this after the fact, and they might come back with questions. So I wonder, Paul, would you be open to perhaps if we had questions, maybe sending them your way after the presentation, or connecting you with members of Kendal at Home if need be?
Absolutely. I'm happy to speak with anyone anytime about Inspire, about sleep apnea. Yeah, so you can share my information. Absolutely.
Thank you. I greatly appreciate it. And Eric, what a journey you've been on, and thank you so much for sharing with us.
Can I add one more thing?
My goodness, please do. Of course.
Okay. If Paul, if anybody wants to talk with somebody who has had the experience and gone through this, I'd be glad to talk to anybody.
That's great. Eric, we appreciate that. We, if you'd like, I can set you up as a qualified patient ambassador with Inspire. One thing I mentioned earlier that's so satisfying is you really hear patients just like yourself, Eric, talk about how it's changed your life and in some cases saved your life. And so people are very, very excited to share that story. And it sounds like you are too. So absolutely, we can have people also reach out to you.
Okay.
I think that's very helpful for people looking into this therapy, to talk to someone who's gone through it. As opposed to someone from the company. I don't have the device, but I can speak to it, of course. So
I'm sure, Paul, you see, you can share stories that people share with you, but it's quite a different experience to hear it from someone that actually went through it themselves, like Eric. So
absolutely.
Eric, thank you for being open to this today and for offering to do that. I think you will go on to, I almost said inspire others. I didn't.
Yes.
Just a try, or at least look into it, get educated on what's out there. I think that's why we do a lot of these presentations, just to make sure that, that our community is educated on, as much as possible on what's available to them. So thank you.
Right.
Thank you both so much.
You're
And
welcome.
I had one comment here from Marla. She wanted to say, thank you all for this information. What wonderful technology. Now to convince her 17-year-old who was diagnosed this summer to actually get fitted for a Cpap machine and perhaps consider Inspire in the future. So see, we're helping others
There we go.
at any age.
Yeah.
So this is wonderful.
Absolutely. Yeah.
Wonderful. Thank you again, truly, both of you, for joining us today. And if there's no other questions, I guess we will sign off. And I wish you both good health. And Paul, I hope everyone in your family continues to feel better. And
Thank you. I appreciate that, Cheryl.
yeah, and Eric, I will definitely be speaking with you soon.
Okay,